Hello, Dr. Brad Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hello, and welcome to another edition of Ask the Chiropractor. Last week we talked about sciatica, and I mentioned the word degenerative disc disease. Now, a lot of people have come to me and told me, I got diagnosed with degenerative disc disease. What does that mean? How did I catch this disease? Is this disease contagious? Is this something that I caught from not taking something? First of all, degenerative disc disease is not a disease as typical diseases are called. I don't really know how it came up with that name. I've got some chiropractic historians I'm working with trying to figure out how they came up with the name disease. Degenerative disc disease simply means your disc is dehydrated. I want you to think about a disc and what a disc job is. You have two vertebrae, and in between you have a disc, and your disc is your shock absorber. It's the one that when you run and jump and move, it takes the abuse. Also, when you have a misalignment of one of the vertebrae, if you have inflammation going on and you have to lean away from the inflammation, the disc will change its shape and adapt to that to allow you to stay away from the inflammation. And when you do this, you get a disc bulge. So when people come to me and said, hey, I had an MRI done, it turns out I have a disc bulge. I just tell them before they have the MRI, you're going to have a disc bulge. Because discs are designed to bulge to deal with the stress above it rather than have the bone deal with the stress above it. So your discs are designed to bulge as your stress changes. It's not shocking to have a disc bulge. By no means is that a reason to react or go over the top with care because you have a disc bulge. It actually means your disc is working, is actually moving and shifting the way it's supposed to. But let's go back to degenerative disc disease. I love these scary titles, disc disease. So the disc disease happens because you have a subluxation. What do I mean with subluxation? Chiropractors know when one or two vertebrae are under stress, the body will take those and lock them up. And then what happens is as those are locked up, there's a stress chemicals that get kicked out at that area. And that stress takes that nerve and goes wherever that nerve goes and provides stress along its pathway, whether it's to a muscle group, whether it's to blood vessels, whether it's to a tissue, an organ. The stress goes down that nerve and goes to that body part. So when we see degenerative disc disease, what we know is that disc is starting to dehydrate and lose its shape. Why does it dehydrate? Great question, right? So we have degenerative disc disease is because the disc is dehydrating. So what causes that dehydration? Let's take another step backwards. How does a disc get its nutrients? The disc gets its nutrients when you move, when you walk, when you run, when you jump. Because genetically speaking, we are all hunters and gatherers. So if you're a hunter and gatherer and you injured yourself and you sat around to heal, a wolf or a bear would eat you, right? So as a hunter and gatherer, we actually heal while we're walking. So when you walk, the muscles contract and they squeeze and they push nutrients in and out of the disc space through a process called osmosis. If I have a disc that's full of toxins, it just sits in there unless I start walking. Then osmosis will pull that stuff out and push the good stuff in, keep it hydrated, keep it moving. Also, there is some rest that's involved in this because somebody will come online here and tell me that we're taller in the morning than we are at night because gravity compresses our disc over time. And that's true. But you won't get any nutrients in and out of your disc unless you move and walk and go. That's why you always hear me talk about 30 minutes of walking a day can change your overall health. Number one thing you can do to be healthier is walk for 30 minutes a day. How do we keep our disc moving? We got to keep moving and walking. Why does it dehydrate? Because the subluxation occurs. And there's stress here, and the body locks them up so you can't hurt them more. Okay? You know how to make this worse? Crack your own back, crack your own neck. Because then what happens, the ones above and below move more, and those become even more fixated. Okay? So the chiropractor's job is to go give you a chiropractic adjustment. When we give you a chiropractic adjustment, are we realigning it? We're moving it in a direction to realign it. But in reality, the biggest thing we're doing is we're freeing it. We're allowing it to move again. Because we know motion's key. So if we give a chiropractic adjustment, we free the joint up, we let it move again, now you can move and walk and start pumping the nutrients in and pulling the toxins out. When it's been fixated way too long, it dehydrates too much and you start losing that disc height. And so a dehydrated disc that's losing its normal height It's called degenerative disc disease. Is this something chiropractic can help? Well, I don't know who else can. Just to be frank with you, I don't know who else can restore that motion. That's the bread and butter of what chiropractic is. We go when we do the chiropractic adjustment, we get rid of the fixations and we restore the motion. So if you're not getting a chiropractic adjustment on that, I don't know how you're getting the nutrients and freeing the fixation and bringing it back to health. I just don't know. I don't know. People claim to do different things. Traction's great. It stretches it. Does it restore the motion in there? No. Does walking or exercising do it? No. Does physical therapy, when you exercise and stretch, restore a lot of the motion? No. The ones above and below. All I know to do is you have to restore the motion. And that's 100% what chiropractic is. We find the vertebrae misaligned and we adjust it. So if you have an x-ray taken, by the way, x-ray and MRI, only ways to tell if you have degenerative disc disease. If you get diagnosed with degenerative disc disease without an x-ray and MRI, they're just taking a dart and throwing it at the dartboard, and that's what they came up with for your diagnosis. So if you have that image, bring it to your chiropractor. Let the chiropractor look at it. I talked a lot last week about how only chiropractors are trained to look at the alignment issues on an x-ray. Your medical doctors and the radiologists don't look at alignment. Sometimes they actually put down alignment's normal. I had a radiologist one time put down alignment's normal. I measured a 32-degree scoliosis. I'm not sure what they think alignment is. Apparently there's different terms, different definitions for that term, alignment, okay? So bring the actual image to your chiropractor, let the chiropractor look at it. If the spurring and the arthritis hasn't grown enough to connect the two vertebrae, then absolutely the chiropractor can work with you. Absolutely. The other thing to worry about when you have degenerative disc disease at one, those two get more and more fixated. Well, that starts to spread above and below. So as this one gets more fixated, the ones above and below can start to affect that too because the overall motion's gone, correct? If L3 and L4 aren't moving very much, there's only a matter of time before L4 and L5 aren't moving very much. So even if you have one that's completely getting the arthritis growing together and it's got severe degenerative disc disease, we can adjust the ones above and below and keep it at the one spots so it doesn't become more spots. So don't think you ever gave up hope. If a doctor says they're pretty much growing together, I don't know what a chiropractor could possibly do. That might be accurate, but we can do a lot for the ones above and below. Having this at multiple levels is awful. Having this at one is bad enough. Let's not let it spread up and down. There you go. Degenerative disc disease does spread. It spreads above and below from the lack of motion, the ones above and below it. So maybe disease is a good name because it does spread. So if you have been diagnosed with degenerative disc disease or someone tells you you have degenerative disc disease, what you want to do is you want to get a copy of your image. You want to take it to your chiropractor. Have your chiropractor tell you how much bony growth's occurred and what's a realistic expectation to how much they can restore the motion. Ask your chiropractor should give you a couple adjustments, see how you do, and then give you a care plan or guidelines of what it's going to take to restore as much motion as possible. If there's already been bony changes, we're limited on the amount of progress we can do, but we can always put the brakes on it and stop it from getting worse. Now, the good news is most discs that suffer from degenerative disc disease bounce back once the motion's been restored. So your chiropractor should be able to get in there and make the chiropractic adjustments, reduce the subluxation, reduce the fixation, and allow the nutrients to start moving back in, and then talk to you about how you're going to do the walking or whatever you need to do. Maybe it's a recumbent bike. Maybe it's getting into a pool. Maybe now that we've removed the fixation, now we introduce physical therapy or massage therapy to continue to free this up and make it better and better so you can walk and not have your disc dehydrate anymore. That's how a chiropractor handles degenerative disc disease. Can a medical doctor tell you whether or not you're a chiropractic candidate for degenerative disc disease? No. Only a chiropractor can determine that. Because again, the medical education is not the same as a chiropractic education when it comes to evaluating the images and the x-rays. So take your imaging, take your x-ray to the chiropractor. We have it all the time. People come here. I've already had x-rays on my back. It's great. Can I see them? Well, I don't have them with me. I'm not a genie. I can't see it without them. So bring the images to the chiropractor, not the report. MRI reports are one thing. Some of us don't have the facility to look at MRIs, but we all like to actually look at our own x-rays and see them for ourselves. As long as you were standing up, and those x-rays should be usable by the chiropractor. So there you have it, degenerative disc disease and chiropractic. It's definitely something we can help, and I don't know anyone that can do it better than us. As far as I know, it's because no one's better at restoring that motion than a chiropractor. All right. Thanks for the question. If you have a question next week, leave a message or a comment wherever you're seeing this, and maybe you'll be the question of the week and ask the chiropractor. Keep having fun, everybody, and remember, if you have a question about chiropractic or chiropractic care, only a chiropractor can answer. Thanks.